Good evening, ladies and gentlemen. My name is Camilla Gregory and I'm course leader for A-Level Biology and also our Medical Society programme. I came to Runshaw 4 years ago, having done medicine previously. So when I came to Runshaw, I wanted to set up the Medical Society. There was already one there, but it was quite small. And in the last 4 years, it's gone from 20 students to 112 this year. So we've got a huge society on our hands now. And I'm really delighted that you've taken an interest in this society, and I'm going to try and take you through the kind of things that we do over the course of the year. Now, when you come to Runshaw for enrolment, you will tell us whether or not you're interested in studying medicine, veterinary science or dentistry. And if so, then you'll come and see me at enrolment. And what we'll do is make sure that you're in the correct lessons so that you can access Medical Society. Medical Society is 2 registered lessons a week on top of your A-level programme, so it does demand a bit more commitment, which is something obviously that you'll need to do as a medic, vet or dentist anyway. And during those 2 sessions, we have sort of quite an extensive curriculum showing you a variety of different skills that are really essential for those careers. So I'm going to talk you through a little bit about what we do firstly. So we start off with first aid certificate. All students who are in the first couple of weeks will come together and do a first aid certificate with St John's Ambulance, and that first aid certificate is valid for 3 years upon completion. It is now a prerequisite for a lot of universities, for medicine in particular, that students do have a first aid qualification. So if you're not doing D.A.V. or you haven't done one previously as a Brownie leader or so forth and so on, then you're able to do that with us in the first couple of weeks, which is really good, and the students really enjoy it because it's very hands-on quite early on. We then move on to the role of a doctor, dentist and a vet. Quite interesting to see, given the media interpretations and so on of those professions, how people actually think of those careers. The normal kind of stereotypes tend to be that doctors are always very tired and overworked, dentists are loaded, and vets really aren't quite doctors. They're not quite at the same standard, which I always find quite interesting, given that actually probably out of the 3 professions, veterinary science is probably the most difficult one to get into. So it's quite interesting to hear sort of the different opinions at that point. And then we move on to what would make a good doctor, dentist or a vet, and how they're viewed not only by society and colleagues, but also by their peers, by relatives and by society as a whole. So it's quite a big section that we do there, which leads in nicely then to communication skills, because obviously quite important to have really good communication skills as a doctor, dentist or a vet. These are both verbal and non-verbal. So we have some very nice examples of doctors, dentists and vets talking to patients and their relatives. And we get students to discuss why they have been so effective or why they haven't been. And as part of that, because I'm a sign linguist, I do actually start the students on doing the first basic starts of British Sign Language. So we teach them how to finger spell, so that if a patient came into an A&E and was unable to communicate verbally or unable to understand verbal communication, they would be able to sign. And from interview feedback that we've had from universities, that's been a really big plus point for our students, because they've been able to effectively communicate in another way. So British Sign Language itself that's a really nice session. The students really enjoy that session. We also teach the students how to do basic sort of treatments as well, so they can say you're going to have an injection or we're going to do your blood pressure and so on, so they can communicate that effectively to patients who may need that. We then move into our first real practical session where we actually teach students how to stitch. So we get skin patches that we have, prosthetic skin patches. We also use fruit as well, because we did use that at medical school, to teach them how to do simple interrupted stitches. That's probably one of the favourite sessions the students have over the year, because it's the first time that they actually get to really be either a medic, vet or a dentist. We do use the proper sutures, we get them to use the forceps and teach them how to sort of knot and everything properly. And it's sort of a day when everybody really feels like a doctor or a dentist or a vet, and they get very excited by that. And then when we move on to our heart dissection a couple of weeks later, we actually get the students to stitch the heart back up, so you get to be a heart surgeon for an afternoon, which is always good at half the price as well. So once we've done that, we move on to reading scans and x-rays. So we look at the various types of scan. We look at ultrasound scans, CT scans, PET scans, MRI scans. At this point this year, we actually got one of our physicists to come in who is an expert in MRI to come and discuss with the students how they actually do MRI scans and how they actually work. That was a really nice experience for the students to see somebody else other than myself or my colleagues who teach on the Medical Society programme. But we also get the students to identify the major organs within a CT scan through a cross-section. So we get them to identify the liver and the kidneys, the stomach, the intestines, the spine, the heart, and so on. And think about how we have to direct treatment, certainly cancer treatment, radiotherapy, and so on, through organs so that they don't affect other tissues. And we've got a really nice 3D software for that, where we can actually move the rays through and you can see whereabouts it would actually penetrate through the patient, which is fantastic. So once we've done all of that nice medically part, we then move on to planes of the body. Now, I put this in when I came here because I know when my first year at medical school, it was one of the first things that I did sort of pick up on was all of these terms were being used: inferior, superior, medial, lateral, anterior, and so on. And I was just stood there, and they're spoken so fast, and I just hadn't got a clue what they were. So I thought, right, well, it'd be really good for our students to know what these terms are. So we use mannequins at this point and get the students to put those mannequins into those different positions so they can identify where the lateral, the proximal, distal positions are upon the body so that they can describe where an injury is quite easily. So we do have some very nice sort of diagrams there showing the different sections as well, the different planes that scans and x-rays and so on can use. And again, it just prepares the students well for when they go to university. We then move on to our first dissection. Most medical society students come in thinking, yes, I get to cut things up. You do, it's great. It also does differentiate for us quite well as well, those who are not going to be medics, dentists or doctors, dentists or vets, sorry, because they tend to faint on us quite early on. The heart dissection this year, I think out of the 112 in medical society, I had 8 who passed out in the lesson, which was quite, I got to practice my medical skills. I was quite happy. Don't think they were so much. We also do rats and eyes as well. So this week we've actually done an eye dissection. We also do a full rat dissection, and we're doing a fetal pig dissection as well later this year to sort of compare the anatomy between ourselves and that of other animals. And of course that enables the vets to have a look at comparative anatomy as well, which is superb, and gain proper dissection skills, because I think when you're given a scalpel initially it's just let's hack it to bits, whereas actually we want to sort of look at the various parts and make sure that they are functioning properly. So that's our first major practical. We then move on to skills again that are really applicable to the 3 courses themselves. So we start on problem-based learning, case-based learning. Problem-based learning bases around the idea that you have a situation in which you are trying to identify what is wrong with that patient, and you work as in a group to achieve the same outcome. So you basically work together. It's very commonly used at medical schools now, although case-based learning is starting to take more of a position there. And it's a very effective learning method in that you are having to go away as an individual and research a particular area and then feed back to your group. So everybody has to take part, and the learning really happens between each other and then with your tutor as well, who will be a doctor. So they do this across all of those schools, veterinary schools, dental schools and medical schools. And basically it sort of gives you skills such as teamwork, recording, cooperation, respect for colleagues' views and opinions as well, because there may be things that you really don't agree with. The ability to evaluate literature as well, which is really essential when looking at the success rates of certain treatments. We then introduce you to OSCE training. So any parents here tonight who are clinical workers, you'll know that OSCE training is basically your practical skills in terms of how you deliver a treatment, how you work with a patient, how you communicate with a patient. Most students are quite horrified when they learn that actually if you don't pass your OSCEs, you won't get your degree. So it's quite an important part of the course when you go to university. And so we like to introduce students to the idea quite early on. So we teach students how to do a basic hand exam. For those of you who are wanting to be vets, we get you to do a paw exam on a dog. And for the dentist, we get you to do a jaw exam as well to identify the healthy nature of the jaw. So it enables students to learn how to do, firstly, a proper examination using the correct palpation techniques and so on, but also enables you to get used to touching one another as well in an allowed fashion, so to speak. We then move on to our main medical ethics as well. So we look at the principal ethics, which doctors, dentists and vets abide by, particularly doctors at this point. respect for autonomy, beneficence, non-maleficence and justice. And we get lots of cases that have been in the news recently. So for example, at the moment we've got Alfie Evans, Charlie Gard a couple of months ago, and we discuss those in class and we debate them and look at the arguments for and against those particular cases, why they were so emotive. Do doctors have the right to be able to make those decisions? Does a judge have the right to be able to make those decisions and possibly override them? And it does cause quite a... We usually run this over about 2 or 3 sessions and get students to really get into a particular case. We get all the students to pick a particular case that has a different ethic behind it, and then we have quite a formal discussion about it and debate it quite thoroughly. And that's probably one of my favourite sessions because you get to hear so many different arguments for and against things that you probably wouldn't have thought of before. So once we've moved on to that, we go back again to some more dissections. We do our rats and we do our eyes, and then we move on to preparing you really for application, because by the time we've got to this point, we're looking sort of at the time we are now really. So we're going to be starting to prepare you for UK CAT and BMAT tests. So those of you who are thinking of doing medicine, veterinary science or dentistry will have to sit one of these admissions tests alongside your A-levels. And universities have like a set point at which they accept students onto the programme with those test scores. So we do provide you with preparation classes for those. This session with MedSoc is basically an idea as to what they are and where you can access the resources to help you start to revise for them. They are sort of mental agility tests and verbal reasoning tests. The BMAT is said to be harder than the UK CAT, although I think it's very much how your brain works. I personally found the BMAT much easier than the UK CAT. So I think it depends on how your mind works. One of them is very much verbal reasoning based, whereas the other one is situational judgment. So you're in a particular scenario, what would you do and why? So it does test you in quite a lot of different skills. So we start to prepare you for that, alongside starting to write your personal statement as well, because as a medic, you will have to submit your application to university in the October. So when you come back into your second year, you've literally got a month before your application has to be in. So by the time you go off at the end of year 1, really your personal statement should be done, and you should have done all the work experience and voluntary work that is needed that can then go onto your form so that it's ready to go in that October. So that first year is quite intensive, and we try to make sure you get all of those skills in by the time you go off in the summer of year 1, so that you can then write your personal statement and you've got everything there that you will need to get in. Once we've done that, we come back on to a bit more practical, so we can show you what anaesthetics do and how they work, the difference between general and local anaesthetics, and then we teach you how to dose them effectively as well, using the weight of the patients. So we have a variety of patient simulations, and we get the patient's weights and so on, and we get you to work out the dosage in for the anaesthetic and then administer them intravenously as well. So again, that day, you feel very much like a doctor, dentist or a vet that day, because you get a syringe and everything, so everybody gets very excited on those days, including me, so it's all good. We then teach you how to intubate as well. So we get usually a cow or a lamb pluck, depending on how generous the butchers are to us that day, and we intubate them. So we put the breathing tube down, teach you how to inflate the cuff and keep it in place, and then see how the lungs are actually working with that breathing tube. So again, another really nice skill that you wouldn't normally have, but it also gives students the opportunity again to sort of imagine what it would be like in that actual profession and learn a skill around it. We then move back into a bit more theory. We look at the problems that the NHS are currently facing. What we do at the end of each interview for students is we try to get them to, if students have been for interview, I get them to fill in a little postcard telling me the questions that they got asked at interview so that I can use those in mock interviews the year after. And last year and the year before, one of the most common questions was, what problems are the NHS currently facing and what would you do to try and help them? Now that, to me, in an interview, if you weren't expecting it, you'd just freeze, I think, at that point. So a lot of the students have come back and gone, oh gosh, you know, I think I answered it okay, but I'm not sure. So we decided that we'd introduce a session on it and look at the main issues, the fact that we've got an ageing population, the fact we've got a growing population, medical advancements, meaning we need a lot more money being spent on equipment. We've got reliance on privatised services nowadays as well. We've got evolving healthcare needs surrounding obesity, diabetes and so on. And of course that's a massive cost to the NHS, alongside issues such as the junior doctor strikes and things like that as well. So we talk about those in quite great detail. Students work together in groups and they try to work out, come up with some theories really as to how they would solve that particular scenario. And I really wish that our nice health secretary could in fact listen to some of our students, because they seem to have quite a lot more sense than he does himself. Not that I'm political in any way, shape or form. We then move on to a health promotion as well. Again, this is something that's come up from interview. It would be if you had a certain community, how would you try to prevent them from getting, say, becoming obese, from developing diabetes, sort of a relevant healthcare issue. And we get the students to promote and find a way in which they would prevent that within that particular community. So for the students here, we get them to present this in the student entrance. Now there's 5,000 students come through here a day, so it's quite busy down in the student entrance. And we get all the students to sit in groups with their promotional materials. So they make leaflets, posters, we've had apps being made, we have videos being made. Basically, sort of educating the college community on that particular area. And it enables the students to talk about it, give ideas as to what would be successful and what wouldn't. For example, in most cases, a mobile phone app wouldn't be effective on an older population. Not all of them, but some of them. There's also the idea that you might use Facebook for certain sectors of the community, whereas you wouldn't for others. Using Facebook, for example, for prevention in children wouldn't be very effective. So there's lots of different things to think about. And again, that's a very enjoyable task that the students really do enjoy. We then have a session on universities and the universities that offer the courses that the students here are looking for. And we then move on to basically get students to have a look at all of them. I always impress on the students that it's really important that you go and have a look at every medical school, veterinary school or dental school that you're hoping to apply for. The number of students who tell me that they're not going to a medical school, they just like the sound of the place, terrifies me somewhat, because you are going to be living there for 5 or 6 years and you need to like it. So please make sure that you do go and visit them. We get the students to have a look at all of them. We look at particular characteristics that certain universities are looking for, so that the students do pick the correct 4 choices for their UCAS form. And then once we've done that, we then start preparing you for interview as well. So we start with our MMI interviews. Most universities now are going down the route of these mini multiple interviews so that students aren't getting trained to give perfect answers in a traditional interview, which meant that a lot of people who were well trained were getting places and not necessarily being the best doctors. So it's allowed this more equality really within the medical profession. So many multiple interviews are sort of 8 stations with 8 different scenarios based around medicine, veterinary science and dentistry, and you have to then go and you are basically judged at each stage. But it's a lot more informal. The students tend to prefer it a lot more as well. So we do run that during the end of year 1 as well. On top of that, we then prepare you as well for a traditional interview, because some universities do both. So you would have your MMI and then you would have a traditional interview as well. So we do give you mock interviews and we prepare you for those, as well as the UK CAT and BMAT preparation classes as well towards the end of year 1. Alongside that curriculum that we run over those 2 weeks, we do have a number of guest lecturers coming in as well across all 3 professions. This year we've had a number already. We've had Alison Speakman, who is a local vet. Her son came to Runshaw and she was very keen to come and speak to our prospective vets about becoming a vet and what they had to do in terms of work experience and voluntary work. We had Operating Theatre Live in as well towards the end of last year, and we'll be having them in again this year. That was a superb day. The students got to dress up, as you can see, into their scrubs with their masks and stethoscopes. They got to carry out a full dissection, which was fantastic opportunity for them. They learnt lots and lots of new skills there in terms of removing organs, removing parts of limbs and so on. So that was a really exciting day. We also have a number of guest lecturers coming in. We have about 2 a month. So like I say, we've had Alison in. We've had the directors of missions from various universities who come in from veterinary, dental and medical schools to say what their university is looking for from students. We have Aidan Blunt, who comes in from Preston Hospital. He's their clinical education manager. He also has Medical Society for a full day, where we go and be a doctor for a day, and we work in their simulated A&E. So this year we had a patient called Annette Curtin, who came in with a collapsed lung, and they had to do the full assessment. When she came in from the ambulance, they had to take the information from the paramedic. They then had to tell the relative of the girl as well. So there was all of the skills that are necessary for being successful as a medic were all there. It's a brilliant day. We also offer the Nuffield research placements as well. So those of you who might be interested in going to the research side of medicine, veterinary science or dentistry, that's an ideal opportunity for you to spend the summer in a laboratory at a university, deciding whether or not you do want to have patient contacts or whether you want to go into the sort of science behind it. We've had 38 applications for that this year, and we got the highest successful number in last year in the country, which was fantastic. We also have quite a focus on palliative care here because a lot of the local universities who take medical students are looking for students to have some experience in palliative care because it's one of the areas that most people kind of try to avoid. And we have a really lovely relationship with St Catherine's Hospice. Their clinical consultant, Andrew Fletcher, comes in to us twice a year with some of his colleagues and talks to the students about life as a palliative care medic. And we also have a really good volunteer programme with them as well. And they've successfully taken, I think we've had 57 students this year go through the St Catherine's Hospice, but they actually get to work on the ward, not just in, say, the shop or in the tea room. They actually go on the inpatient ward, which is a fantastic opportunity. And Bolton Hospice as well, we have quite a good relationship with. So we have a number of those places available for work experience as well. So, alongside that, we also have the Preston Widening Access Programme, which you may be aware of. We're one of only 2 colleges in the country that offer this programme. It is for widening access students, so for those of you who've come from a background where either parent has not been to university, lower income backgrounds, or live in a certain area. However, those criteria are becoming less and less rigid as the years go on. And we have very successfully got a number of students through this programme. It involves them going to Preston Hospital to carry out sort of a course by itself, really, over the course of the 12 months of year 1. And on completion, they get a guaranteed interview for medicine at Manchester. And if they're successful at interview, they get a lowered entry requirement of ABB, which is quite a significant drop from the AAA offers that are available at the moment as well. And then our most exciting news will probably be for you guys is that from September, we are also going to be starting a foundation medical programme here with UCLan. So you will spend, if you get to the end of your second year and say don't quite get your grade, so you might have been predicted AAA and then maybe get, say, ABB or BBB, you will be able to access that programme with me here for another year. And at the end of that year, you're then guaranteed an interview at UCLan. And if you then get past your interview, you'll be guaranteed a place for medicine at UCLan the year after. So it would take 6 years rather than 5, and you'd have an extra year with yours truly, but that's great, you'll be fine. And you get to do a whole foundation year with us at the other campus that we have here at Runshaw. So that's another massive opportunity for you that no other college has at the moment. And with you being Northwest students as well, you would get extra weighting as well when they're making the decisions on places because they're trying to keep doctors in the Northwest at the moment. So a really big opportunity for you. So I think I have told you everything. If you have any questions, then please do come to the front. You can have a look at the literature we've got here as well. I should say that alongside the course, the students do a Gold Crest Award, which is an additional qualification. It's done on a particular area of medicine, veterinary science or dentistry that you're particularly interested in. And at the end of that, you get a lovely golden certificate, which is very highly sought upon by the universities themselves. So there are some examples of those over here of students who have gone on to do medicine in the last 12 months. And there's also some other information about BMATs and UK CATs as well. So if you have any further questions, then please do come and speak to me. But other than that, thank you very much for listening to me. And I hope you enjoy the rest of your evening here at Runshaw. Thank you. Thank you.